I propose that the Animal Welfare Act protect all animals and restrict testing on them. Would you like to have your pet tested on? I know I wouldn't. I love my pets very much. According to procon.org, the U.S. Department of Agriculture reported in 2010 that 97,123 animals suffered pain during experiments while being given no anesthesia for relief. According to healthresearchfunding.org, almost 95% of research animals are not covered by the Animal Welfare Act. Animal testing can hurt the animal. There are many alternatives to animal testing. Human skin cell cultivation is one of those alternatives. According to procon.org, artificial human skin, such as the commercially available products Epiderm and Finsert, is made from sheets of human skin cells grown in test tubes or plastic wells and can produce more useful results than using and testing chemicals on animal skin. Also from procon.org, in vitro testing, which means in glass testing, such as studying cell cultures in a petri dish, can produce more relevant results than animal testing because human cells can be used. There are also many other alternatives to animal testing. From neves.org, these are computer models and simulations, computerized patient drug databases and virtual drug trials, and microdosing. Microdosing is where humans are giving very low quantities of the drug to test the effects on the body on a cellular level. Animal testing wastes a lot of time and assets, and it can mislead researchers. Animal testing is very expensive. According to procon.org, an unscheduled DNA synthesis animal test costs $32,000, while the in vitro alternative costs $11,000. That is a huge change in price, and I don't see why you wouldn't go with a cheaper, more safe alternative and, save yourself some time and money. Animals also react differently to different medical conditions, and that can make the results from tests irrelevant. According to HuffingtonPost.com, a reliance on mice in medical research has been potentially useless for 3 major, often fatal conditions: sepsis, burns, and trauma. This was concluded from a 10-year study that was worked on by 39 scientists from across the country, and it reports that human and mice respond to inflammation completely differently. Also, according to procon.org, 94% of drugs that pass animal tests fail in human clinical trials. That's kind of a lot, which means that you're wasting a lot of money doing all of those tests. Also, according to procon.org, the anatomic, metabolic, and cellular differences between animals and people make animals poor models for human beings. There might be a similar DNA makeup, but everything else on the inside is different. With the results coming out as inconclusive because animals are so much different, it can cause scientists to ignore potential cures and treatments for humans because it fails the animal test, so they're not even going to try it on the humans. According to Newsweek, even if a new chemical entity is deemed safe at the animal stage, it only has an 8% chance of being approved for human use. So there's no point in doing it if you're not going to use it for a human and waste all of that money. Animal testing is inconclusive, unfair to the animal, and a waste of time and assets. The Animal Welfare Act should protect all animals and restrict testing on them. Thank you.